always have a really good answer for me. One of the other questions that I like to ask in my interview process, actually there's many questions, there's probably about 25 questions, but I will show you an ECG and ask you to respond to it. So is this patient, I'll show you an ECG, is this patient stable or unstable? If they're unstable, I want to know what your critical thinking is and what your thought processes are around how would you help this patient? How would you respond to seeing maybe some sort of dangerous arrhythmia like VTAC or VFib? So we really do run a pretty rigorous program to get into critical care nursing. However, once you're there, it's very, very exciting, and like I say, I really feel like we're a family. We work together as they do in almost all ICUs. One of the things that I love about the ICU is we do something called the ICU swarm, and I believe this is done in most ICUs around in Canada. But so if we have a patient who's newly admitted or a patient that becomes unstable, we swarm the patient with nurses in that we do everything that we can. We may have 3, 4, 5 RNs in the room with that patient, making sure that everything is done quickly, timely, and that we can all problem solve and critical think together through getting this patient out of their unstable phase of their illness. And I've always felt very, very supported in critical care as well with other nurses. And we usually have a good combination of experienced nurses with less experienced nurses. So there is always that feeling of safety. So what are some of the attributes that I think nurses need to have in order to work in a critical care area? Well, actually, I think these attributes are important for working anywhere. But first of all, critical thinking. And it kind of has to be a kind of a quick critical thinking, advanced problem solving skills, leadership skills, because a lot of times you may find yourself in a situation where you're in charge, or you might be the code team leader, or you might be on the rapid assessment team or the outreach team, where you are the person who is sort of in charge. So knowledge, skills, and ability is so important. Fierce advocacy, not just for your patients, but for the family members and for your colleagues, for all of your colleagues. And you also need to have good judgment as well too. And just the ability to really think on your feet. That is very, very important. And that's why I think it's really important to have all those foundational skills before you land in an ICU setting. It really allows you to you'll still be learning on the job, but to have those foundation underneath you first is probably most important. I also think it's really important that critical care nurses contribute to the positive image of nursing as well too, because not only are you working inside of an intensive care unit, but you are also part of a code team. You might be part of the rapid assessment team, or like I said earlier, the outreach team. So you become the face of the critical care area. So really, really important that it's always a positive, and you come from a positive and a very supportive place for all other healthcare providers. So what happened in Alberta about 10 years ago is they really wanted to streamline the education that was happening throughout the province, because we know that, and I believe most provinces have done this. So they developed an orientation program for adult critical care in Alberta that is completely streamlined. It's a 2-month training program. And so even if our nurses have their ACCN or one of their adult critical care nursing certifications, we still put them through the what we call the OPACA program to ensure that they have our Alberta training, and again, all knowledge is good knowledge and all education is good education. So some of it may be a little redundant, but in Alberta we find it very, very important that everybody has the same education. And so that has been a wonderful addition in the last 10 years to critical care. So again, I think I talked about my hiring practices, and if any of you have any questions about that, how you can get hired in an ICU, I have lots of good tips and tricks and things that you may need to know. The experience with COVID so far, COVID, again, this feels unprecedented. Initially, when COVID-19 started, I felt like I'd been through this before with H1N1 in 2009. However, COVID-19 is so much more, the treatment that we're doing it has went from supportive treatment to really, for all, to really individualized treatment in the ICU setting. And so we know that the patients become ill extremely quickly, and they're so very ill, and they typically require one-to-one care, if not 2 nurses to 1 patient. So it is extremely busy, it's extremely contagious, and I would say for all of you who are, I think this is a great time to get to be in nursing, but also a little bit scary too. But just know that here in Canada, we really support you. We do make sure that you have your proper PPE, and we think that, we got to ride this out for another 6 months or so, and we're hoping that we have a vaccine. But for student nurses, we need you all. I think it's really, really important, and I think it doesn't matter whether it's COVID-19, there still will be something around the corner. I don't know when it'll happen, but there will be something. So, we just always need to maintain our own safety and the safety of our patients. So COVID-19 has been extremely challenging, and it's more just because what we know one day, it becomes new the next day. We think we know. What we know for sure is that we really don't know, and we're doing our best, and we're navigating it the best way we can. And so for my students right now in our clinical setting, I think we're doing a phenomenal job of just maintaining our own safety and the safety of our patients through making sure that we're always masking, hand washing, and using proper PPE. So I think if there's any recommendations for any of you to get into critical care, I think it's to build those foundational skills, so important, and take a critical care training program. And courses like ACLS, which is Advanced Cardiac Life Support, Pediatric Advanced Life Support, TNCC, Trauma Nursing Core course, all of those courses are also, they will build that foundation of critical care for you as well. I know as students you're not allowed to take those courses, but once you finish, you are allowed to take those courses. Now those are courses that I've done my entire career, and they also get you set up and ready to communicate in a way that we do communicate in critical care. So all excellent courses. So to end, I will tell you that in nursing, whether you're a student or whether you're a registered nurse, you're going to have wonderful days, but you're going to have difficult days as well. And the difficult days are probably the most important days. And from there, you choose the type of nurse you want to be. So anyways, have a wonderful day, have a wonderful conference, and email me. Kellen and Richard will provide my email address if you have any further questions about critical care.